Well, good afternoon. Today, in consultation with Dr. Shahab, we are setting June the 8th as the target date for Phase 3 of the Reopen Saskatchewan plan. Phase 3 will see restaurants and bars reopen operating at 50% capacity. Gyms, fitness facilities will be able to reopen, and so will many other personal services, such as tanning parlors, manicurists, pedicurists, estheticians, and makeup applications. Child care facilities will be able to open with a limit of 15 children per building space. And of course, like all other businesses that are open today, each of these businesses will need to follow good physical distancing and cleaning practices when they do reopen. There are general guidelines and some more specific rules for different businesses. For example, restaurants will be table service only. There will not be buffets or salad bars available. Recreation areas in bars and restaurants must remain closed for now. This includes things like dance floors, pool tables, VLTs, darts, and video games. Child care facilities located in long-term care or personal care homes must have a private entrance, a separate space, and absolutely no common areas. And there's no interaction between the children and our long-term care residents. Gyms will need to maintain stringent cleaning and disinfecting protocols. All of these rules and guidelines will be posted on the government's COVID-19 website, and some of the specific guidelines for Phase 3 businesses are being finalized as we speak. And they will be updated tomorrow on the government website. I want to emphasize that June the 8th is a target date. We hope to begin Phase 3 on June the 8th, but that date can change in all or in part or in areas of the province, depending on the situation with COVID-19 over the next couple of weeks. We've just begun Phase 2, so it's too early to tell what impact, if any, that it will have on our numbers. But we thought it was important to announce the date now so those Phase 3 businesses could begin preparing. Ultimately, the most important factor in the success of the reopening plan as a whole is each of us. It's all of us. All of us have to continue doing our part. Physical distancing, washing our hands, avoiding large gatherings. And the good news is we can do all of these things, and at the same time, we can continue to go out and support our local businesses. In fact, I would encourage people to do so. Now is a great time to support Saskatchewan business as they reopen and as they bring back jobs into your community and mine. We just need to remember to do it safely, and I know we can, because we have been. Also, when we begin Phase 3, the maximum size of indoor gatherings will increase from 10 to 15 people. And based on our recommendation from Dr. Shahab, up to 30 people will be allowed to gather outdoors, so as long as they are maintaining good physical distancing practices. Now, while 30 may not seem like a lot of people, it would allow for such occasions as a small outdoor wedding ceremony or a small graveside memorial service for a loved one who may have passed over the course of the last few weeks. I'll let Dr. Shahab speak more to outdoor gatherings in a few minutes. Places of worship have also been added to Phase 3. Government officials have been speaking with and working with leaders from our faith-based communities about how to safely expand worship activities in our churches, in our mosques, and in our synagogues. And we expect to be able to provide some further guidance on that in the coming days. And I would thank them for their work. I would thank these leaders for their engagement with the government of Saskatchewan. Today we're reporting 2 new cases, both in the far north, and reporting 15 additional recoveries, reducing our number of active cases to 106, 93 in the far north, and 13 in the rest of the province. So thank you again to everyone who is working so hard to manage the outbreak in La Loche and the surrounding communities. Earlier, we announced that health officials were offering door-to-door testing in La Loche, and today I can confirm that the testing teams have been to each and every door in the community of La Loche. And with that, I will turn it over to Dr. Shahab to make a few comments.
Thank you, Premier. So again, while we have extensive guidance online, we will be posting additional guidance specifically for services and businesses opening in Phase 3, including restaurants and gyms, as well as guidance on outdoor gatherings, which will go up to 30. And we already learned a lot in terms of our day-to-day interactions, and certainly, we all need to think about if we're planning events after June 8th, about if we are having a gathering, either indoors or outdoors. Just because it's 30 doesn't mean every gathering has to be 30. You still want to maintain physical distancing. You shouldn't go if you're unwell. You still need special precautions around people who are elderly or may have other risk factors in terms of hugging and having extremely close contact. And I think if there's food involved, I think we have already seen in the past that when there's a buffet-style food service, that can be problematic indoor or outdoors. But having said that, you would have noticed that gathering size of 30 was initially in phase 4, but outdoor gathering size of 30 is now moved up to phase 3 because we feel very confident for most of Saskatchewan that with the efforts everyone has put in, we are at a place where we can move that up even a bit to phase 3, especially for outdoor gatherings. But I think we need to continue to apply the knowledge we've all gained over the last 2 to 3 months as we plan for outdoor gatherings. And my other comment would be that, while phase 2 seems to be going smoothly, we have received some reports about maybe a bit of a crowding in a business or, a lot of actions happening in an aisle that were a bit different from how things are supposed to happen. So again, we really need to work with business owners who've gone a long way to reopen in a safe manner and support them in terms of shopping locally and purchasing items that we need locally, but being considerate in terms of picking what we need and not trying on a lot of materials and not, having a lot of stuff moving off and off a shelf and not crowding with each other when we need to get a particular item. So with that, I think we feel very confident that phase 2 is going smoothly and we'll be well prepared for a smooth reopening for most of Saskatchewan in phase 3.
Thank you, Doctor. Thank you, Premier. We now have time for questions. We'll take our first question from the phone line. Operator.
We have Adam Hunter with CBC.
Hi, I'm wondering about faith gatherings, given the changes to phase 3. Officials in the U.S. have been worried that some worship ceremonies are susceptible to outbreaks, and some churches that have reopened have been shut down. How do you plan to make sure that doesn't happen in Saskatchewan?
I would just make a brief comment, and Dr. Shahab, I'm sure you will follow up, but we're working very closely with the Chief Medical Health Officer's office, as well as leaders in our religious communities on what this structure can actually look like so that it is safe for the congregations to come together in some way, shape, or form so that we can practice the religions that we want to, choose to, and have a right to practice in this province. So Dr. Shahab, maybe you'd speak a little more specifically to those consultations that are going on. And this is a collaborative effort I would put forward.
I think what I've heard from religious leaders, both within the province and from my counterparts in other provinces, that on the one hand, congregation size seems to have increased with online and virtual platforms as well, so that may still continue, and people can certainly access those going forward if they feel that that is a better option for them. But we also know that whenever there's an indoor gathering, when items are passed back and forth, when there's food involved, that seems to be a bit problematic, especially if it's a common serving area or eating food with your hands. And faith leaders have the biggest stake in making sure that their congregation remains safe. So they are and will be looking at a lot of these areas where they can maintain that physical distancing as you enter a building, sit in a way that there's physical distancing, not have items handed back and forth. And also, we have seen in other jurisdictions where there's a lot of singing involved, then maybe there needs to be a bigger separation because talking, shouting, singing, crying, all these things increase transmission risk. So those are all considerations as we plan, the opening of faith-based gatherings, or even our outdoor events, either weddings or funerals, that we just need to be considerate of some of those areas.
Follow up, Adam?
Yeah, this is for the Premier. Premier, your government's deciding what can open and when. why can't we have a decision on resuming the legislature, and is that going to be part of the phase 3?
Well, that is a separate discussion that is going on among the respective House leaders of the two parties that have seats in the House. So that is a discussion. My understanding is there's an option that's been provided by the government, a House leader to the opposition House leader, and we would hope that we would be able to move forward with the introduction and passage of a budget with some legislative scrutiny on that. I won't preclude or put those that option into the public realm, as I think it's important for the government House leaders and their respective caucuses to discuss that. But I would say that the option that we have put forward is the most comprehensive opportunity for budgetary legislative scrutiny of any option that has been put forward in this nation by any province or territory since the emergency measures have come into effect. It's important for this government, and it's a preference of this government, and it's a priority of this government to introduce and to pass a budget on behalf of the people, to have it have the legislative scrutiny that it deserves, and also to have it have the purview and scrutiny of the people of this province. As I've said before, this is a budget that this government is proud of. This is a budget that we want to continue to communicate and to work with the people of this province because of what it is doing. It is investing in their family, their community, and investing in the advancement, reopening, and continued strength of the Saskatchewan economy.
Steph?
Yeah. Mr. Premier, if this is a priority to get back into the legislature to present this budget in some form, why are you even bothering with this negotiation? You could put forward a government motion and just go ahead and reconvene things kind of on your own, and you wouldn't have to have this back and forth and this kind of drawn out process. So why even bother with this negotiation?
This is why we have House leaders, is to do this work on the structure of what an introduction and passage of the budget would look like, given the unprecedented circumstances that we are operating in. Listen, the priorities of the government today are this. One is our response to COVID-19, both from a healthcare delivery perspective and what we are providing to the people of this province to ensure that we can have a healthcare system that can manage not only COVID, but also manage other healthcare delivery services that we need to continue to offer to people of this province. Second is to introduce and pass a budget in the legislature. That is a preference, and it is a priority of the government of Saskatchewan, which is why we have put forward the option to have the most comprehensive legislative review, if you will, since provinces and territories have entered into their emergency measures. We saw in Alberta, for example, where they have they introduced and passed a budget in one day, limiting debate to 3 hours. So we have provided an option that is in excess of that. It provides an opportunity to introduce and pass a budget here, and it's our hope that the government House leaders, both of them, will accept the offer that is put forward, and will be able to do just that. We have no other legislative business that is a priority at this time for the government, given the existential circumstances that we find ourselves in. There's businesses across this province that are operating much differently than they were a few weeks ago and a couple of months ago. The same holds true for the Legislative Assembly. So there is no other legislative business in this province that we are looking to move forward in the immediate future. However, we would like to move forward with a budget introduction, a budget passing, and any related budget bills that may be associated with that.
Follow-up, Steph?
Yeah, it's a different question. We know the federal government is working on this national framework for contact tracing and testing to support provinces. What is your ask of the federal government for what you need to see happen, and maybe what other premiers need to see happen, kind of given your role as COF chair, when it comes to contact tracing and testing supports?
Right. I won't speak to specific asks. We just had a Council of Federation meeting just an hour ago, and we'll be having a First Minister's call very shortly. And this has been a discussion over the past number of days, is a discussion at both of those tables, and I expect will again be a discussion here today. And I think the goal is, as we start to reopen our economies across this nation and across North America and around the world, there is going to be some additional interprovincial travel, however limited that can be, and it will be as limited as it possibly can. But as we reopen our economies, there will be some additional travel. Truck traffic, for instance, may increase as our economies start to scale up. Ultimately, that will extend in the weeks, probably months ahead, to some additional necessary international travel. So we have an opportunity here now to work with our federal government on not only our testing capacity, but also our contact tracing capacity on an interprovincial basis, and then building into an international basis. And I would provide this example. In Saskatchewan, we feel that we have a very good contact tracing effort in place. We feel that we can, between the testing capacity we have, identify COVID positive individuals through the contact tracing efforts that we have, be able to trace those that have been in contact with them, and then ultimately isolate those individuals that need to be isolated. We can do that within the confines of our provincial borders. It becomes somewhat more challenging as people start to venture outside of the provincial borders, as Saskatchewan Health Authority does not really have the contacts or the purview to do that contact tracing in places like Winnipeg or Toronto or Edmonton, Calgary or Vancouver. So we're working closely with other provinces on putting together a team, if you will, that would be able to communicate back and forth interprovincially and to get that into place so that we can do some very just as effective contact tracing across our nation in the weeks ahead, and then ultimately build on what we hope will be that success to have a framework to build on international contact tracing as in the months ahead. We do expect with the growth of our economies as they open, that there will be some additional international travel, and we need to be able to identify when we do identify those individuals that may be COVID positive that have traveled across interprovincial borders, international borders, that we can identify the individuals that they've been in touch with. So this is the early stages of, I think, of a collaboration first among the provinces, also involving the federal government, ultimately quite involving the federal government when we get to international travel. And I think it speaks to the strength of the Council of Federation table and the individuals sitting around that table whom I'm thankful to work with, but also the strength of the individuals around that table and the relationship that they're having with the federal government in managing what are really unprecedented challenges that have been put before us.
We'll take our next question from the phone line. Operator?
We have Murray McCormick with the Leader Post.
Greetings, guys. Manitoba announced today that its professional teams are allowed to resume training and practicing inside the facilities beginning this Friday with a whole lot of restrictions. And I wonder if Saskatchewan might be in the place to let the Rough Riders start practicing now, or what do you think when that might be possible of happening?
I would first and foremost say that the Blue Bombers need the practice, quite frankly. And our Saskatchewan Rough Riders, like the Blue Bombers, are if they were to start practicing or start requesting the practice, they would be able to do that. That is their workplace. That is, and we have many workplaces in this province that are operating with people in addition to the 10 person order that we have in place. However, in doing so, the expectation would be that the Rough Riders organization, or the Blue Bombers organization in this case, would take every precaution to keep not only the players safe, but those in around the team safe and associated with the team. So we would be more than willing to work with the Rough Riders organization on putting together a plan, if they should so choose, on some of the parameters that may be beneficial for that to occur. In fact, we've had discussions with the Rough Riders organization about the league in general and what opportunities there are for this type of preliminary practices to begin. So we're, and we'd be open to additional discussions as well through our Chief Medical Health Officer. I'm more of a fan. Dr. Shahab is more of the individual that would work closely with the Saskatchewan Rough Riders or any other employer in the province on what the safe parameters of going back to work are. Doctor, anything to add to that?
I just add, and we're also, while the practice for teams are closed facilities where only teams go, we're also obviously developing guidelines which will be available from tomorrow for gyms, which are public spaces. So again, there's going to be good information even for public spaces where people want to go and exercise and engage in healthy physical activity. And of course, outdoors, we have already seen people engaging in physical activity and other activities in a very safe manner.
Do you have a follow-up, Murray?
Just Premier Mo, what do you think about the postponing of the Grey Cup to 2022?
Well, it's disappointing. We were looking forward to hosting the Grey Cup here in Regina, not only for the event and for the ultimate success of our hometown Rough Riders, but most certainly the economics were very much being planned for by the community. But we, as disappointed as I say we are, we fully understand the challenge that we are collectively facing as a society with our response to COVID-19, and we understand how this just may not be able to occur in the way that we had originally planned. We're very thankful that the CFL has allowed us to start to plan for the 2022 Grey Cup, and we know that will be the greatest event ever held in CFL history, and we look forward to hosting that event. And I would just add that with the platform that has been put forward, if there is the ability to play some type of a semblance of a number of games this year, and that the Saskatchewan Rough Riders would be able to ultimately be the winner that would host the Grey Cup this year, if in that event, we would have the opportunity to actually host the Grey Cup here yet this year and host it twice in 3 years. So there may be an opportunity for us, there's still a chance.
We'll take our next question from the phone line.
We have Mark Smith with CTV.
Hello. The South region hasn't seen any new cases since April 29th. Has the province considered allowing certain cities or regions to start going forward with phase 3 earlier than June 8th?
No. Anything to add, Doctor?
Yeah, I think at this point we still want to be very meticulous and systematic. But having said that, we do want to move to a phase where all of us are able to see, like you described, that in our part of Saskatchewan, what has been the COVID activity over the last 4 weeks or 8 weeks, and so that we're all informed about the risk being fairly low, but we still have to practice all the other things that we need to, but allows our phases to open successfully. But then also some cautions if we start to see increased transmission in a particular part of the province.
I would just add this really speaks to the collective success that we can enjoy as Saskatchewan people do the right thing in adhering to the public health orders and recommendations that are in place. And this is why we are able to be moving forward with phase 2 of our Reopen Saskatchewan plan as of earlier this week, and ultimately moving towards phase 3 on June the 8th. And we're working very hard with those businesses involved to ensure that they have the parameters in place that will ensure that they can operate safely. Again, the success comes down to each of us as individuals.
Follow-up, Mark?
Yes. What would need to happen for the target date on phase 3 to change to say there's an outbreak? Would that move it further into June?
It's possible, but as I have said time and time again, I really believe that as we look ahead, we are able to test and contact trace outbreaks at the very early stages, which allows us to isolate not only the individuals, but isolate the outbreak to a facility or to a community or to a sector potentially of our economy, if you will, and able to do that very quickly and competently, I would say, as we've shown time and time again. We're working through a situation in the Northwest. We've had outbreaks in a number of different healthcare facilities where we've been able to isolate them very quickly. So any delay, I would say, in the phase 3 would be, in my opinion, likely secluded to a specific community, a specific area of the province that may be experiencing some challenges. We've done this with the Northwest. We did this briefly in the case of Lloydminster. But we haven't had to do it anywhere else in the province. For that, I'm grateful for what Saskatchewan people have done because it's ultimately the success is contingent on them continuing to adhere to the public health orders that are in place. Doctor, anything to add to that?
Yeah, I'll just say that on the one hand, I think the Premier is right that even if there's an outbreak, if it's a specific outbreak in a facility or in a sector or a workplace, while it's very concerning, it doesn't really impact community transmission to the same extent. But I would also like to request that we see more activity now out and about, both for recreation and commerce and retail. I think we still need to, pay attention to the little things, physical distancing, hand washing before and after, not going out if you're sick. Those are, things we've all learned to do well, and we need to continue to do well to make sure that we all succeed moving forward in this new normal. I think that's really important. It's very easy to, even when we start having gatherings, to start behaving as we would have, before December, for example. But I think we just need the discipline to just behave a bit differently, even as we enjoy, all the opportunities that are now being made available.
I just say I always get concerned when Dr. Shahab begins his statement with, on one hand, the Premier is right, I worry what's on the other hand. But the fact of the matter is people are getting out more, and that is a good thing. But Dr. Shahab is absolutely correct in the fact that we need to continue to pay attention to the little things. That's why we have such a reduction in our cases in the vast majority of communities in this province. The little things like hand washing, using hand sanitizer, proper physical distancing, just being aware of your surroundings and who you've been in contact with, and limiting that to necessary contact. Those little things matter. Those little things are individual choices that we make, but they speak to the collective success we're having as a province.
We'll take our next question from the phone line.
We have Phil Tank with the Star Phoenix.
Yes, I'd like to ask about if you have a sense of how long the 50% capacity is going to stay at restaurants and bars, because a lot of them, and it's not just in Saskatoon, a lot of them say they can't make a go of it in the long run at 50%. So I'm sure a lot of them want to know when that might be increased.
We haven't had that discussion specifically, as that is a while out, and it just is too early to really lock that in as to when. But maybe Dr. Shahab would speak to some of the parameters that might impact the decision as to whether you would come up from a 50% capacity in restaurants.
I would just say that, I've heard that for some establishments, there's been an increase in takeout as well, and that may still continue. But once we move into restaurants and gyms, they're a bit different from retail environments. And I think we need to proceed cautiously to make sure that the reopening is a success. We need to reopen, see over at least 2 to 4 weeks that there aren't any concerns. And reopening while COVID-19 transmission is low is good, but we also know that in the future, that may change. And we would like that even if COVID transmission picks up a bit, businesses stay reopened. So we really want us as customers to learn how to, starting June 8th, enjoy a meal in a restaurant or exercise in a gym in a safe manner. But then also keep in mind that even if COVID activity was to increase, how can we then continue to keep the business sector open rather than rolling back? And once we've kind of become comfortable with that, I think we can certainly, if COVID-19 activity remains low, look at other considerations. But at this point, I think if we can do this successfully and maintain that success for a while, I think that'll be really important.
You have a follow-up, Phil?
Yeah, you're probably aware that the president of the Canadian Medical Association said that provinces are gambling with reopening and that we're not prepared for a second wave. I'd like the response of both Dr. Shahab and the Premier to that statement.
Well, I would say that I won't speak to a second wave specifically, but I will speak to what we are prepared to do in the weeks and months ahead. And I've said this a number of times. We believe that we have the testing capacity, contact tracing capacity, very competent contact tracing efforts that are in place, as well as the ability to isolate any that need to be isolated in place. And we feel that we can identify any outbreaks long before they come to the what would be considered a second wave. We believe that we can identify these outbreaks at a very regional or even a facility level quick enough, soon enough, and isolate them to that level so that they don't become a province-wide outbreak or pandemic, if you will. With respect to if the preparations, if they do, we have been using this time, and the Saskatchewan Health Authority has spoken to this in detail. We have been using this time to prepare our healthcare system for whatever it may be presented with in the weeks and months ahead. All of this is preparations for us for the interim until such time that we have access to a vaccine, which won't be the answer, but it will be a tremendous step forward if there is a usable vaccine that can be made available to the people of this province and the people of the world. So all of these efforts are for in that time between now and whenever we would ultimately have a vaccine. Now, I can't speak to how thankful and grateful I am and how proud I am of the people of this province, because the ultimate success that we have been having to date has been because of what individuals in this province have done. And they are getting out now and enjoying the weather, and I encourage them to do so. But as Dr. Shahab says, pay attention to the little things. The little things matter in addressing the spread of this virus. People have been doing that for over a couple of months now, and if we can continue to do that until such time we do have access to a vaccine, I am confident that we will be able to manage the outbreaks as they arise. And we must remember that our initial goal was not to eradicate COVID-19. Our goal always has been to ensure that we keep the infection rate at a low enough level that our healthcare system can manage that. We've increased the ability of our healthcare system to manage it, but we still need to keep it as low as possible. Dr. Shahab, anything to add? No.
We'll take our next question from the phone line.
We have Allison Bamford with Global.
Hi there. I'm just wondering, places of worship weren't included in the original reopen plans. I know there were calls to have it included in phase 4. I'm just wondering what changed to have them included now.
The work that we've been doing collaboratively with Dr. Shahab's office, the Saskatchewan Health Authority, and the leaders, the religious leaders from multiple denominations across the province. We've been working very closely on how can we have some semblance of a mass in a church, in a synagogue, or in a mosque, sooner rather than later, but have it safely. And so, as I said, this has been very collaborative work. The calls came in through MLAs, through our business response line, and we're very quick to engage to see if there is an opportunity for this to occur.
Follow up, Alison?
Yeah, I know Mr. Premier said he's happy with the contact tracing that's happening here in the province. I'm just wondering if we're looking into or would consider getting an app like Alberta has.
Yeah, I've had conversations with Premier Kenney with respect to the app that they're utilizing there, and I understand that it will help. It's a tool to use in contact tracing. As two people that may have the app downloaded, if they are in contact, one of them becomes positive, it alerts the other one very, very quickly. So there is benefits to apps that have been used. That app or other apps that are being looked at or are used in other areas of the world. Some of the challenges with an app, and it is an effective tool, and it is one that I wouldn't say is under active consideration in Saskatchewan, but is being discussed as a tool that may enable our contact tracing teams. And I would defer to the people that are doing that work as opposed to myself making a decision on whether or not we utilize an app like that. But it can be useful if you have enough penetration as far as the number of people, percentage of the population that are actually downloading the app. It's as effective as simply that. So I don't know if you have any other comments on the app specifically, but that would be a decision that I think probably the government would make, but would make it on the recommendation of health officials.
Yeah, no, I would agree. I think it can be a useful tool, but it doesn't take away from what all of us need to do, because in jurisdictions where it's been a voluntary download, 10, 15, 20% of the population will download. So it still means that all of us still have to do what we're doing to keep everything safe.
Yeah, I don't think it replaces contact tracing. It would be a tool that they could use in contact tracing. We have talked about this on the Council of Federation call, and to the extent that there are multiple provinces, territories that are looking at different apps. Alberta has moved forward with one that I believe was used in Singapore. And ensuring that as we move forward with that, is there an opportunity for these apps to talk to one another, so that if there's a different app that's being used in Quebec or Newfoundland, for an example, it would speak to the app that is being used in Saskatchewan or Alberta.
We'll take our next question from the phone line.
We have Lisa Schick with CJME.
Hi, I'm just wondering, is this a bit quick to be picking a date for the third phase already? I thought public health was going to be monitoring what happens in the second phase and then deciding when to start the third one, but it's only been about 3 days of the second phase, so how can you know how well this phase is going in just 3 days?
I would speak just very quickly to, we wanted to get a date out that was allowed for that monitoring to happen, but also allowed for the phase 3 businesses to start to prepare, as many of them, restaurants, for example, may be changing some of the structure of how their business operates in the way that grocery stores and others have over the course of the last couple of months. But maybe you'd speak a little bit more to the date itself and what will happen between now and June the 8th.
So we have been monitoring consistently, even prior to phase 1, and we'll continue to do that as phase 3 reopens and then moving forwards. And I think we need to also continue to understand what are the settings in which transmission risk is enhanced, because if there's community transmission, our colleagues who do the contact tracing go into details about what you did, where did you go the last 14 days, and that helps us to inform us and then everyone, the public, in terms of what really is the risk, because the risk may be very specific, and that should not really jeopardize a whole sector that's reopening, but can give feedback to that specific sector in terms of maybe they need to look at some aspects of their business model differently. And we're hoping that approach will keep things safe as we move towards reopening. And 2 to 3 weeks does allow us to also flag any concerns in specific parts of the province where phase 3 could potentially be delayed. At this point, we hope that doesn't happen and things remain quiet. But certainly, even towards phase 3, or even once phase 3 has started, if there's a concern in a specific part of the province and if it's linked to a specific activity, we need to still provide that feedback to that part of the province or that specific activity in terms of what can the business do better, what can customers or people who are visiting that business or that sector change in terms of their behavior. So, and that will continue, as phase 3 opens and even beyond.
Follow up, Lisa?
Yeah, so what I'm kind of hearing from this and a previous answer from the Premier is that if there were an outbreak or something, then that would probably only affect that area of the province or that specific sector. So does that mean that how one phase is going doesn't really affect the date for the next phase?
I think there's 3 different answers to that. One is if we have a localized outbreak in an institutional setting or in a specific workplace, that generally doesn't impact what's happening outside of that institutional setting or workplace, as long as there aren't too many contacts outside that we can't trace. That's one thing. The second thing is if we see an outbreak, which is a community-driven outbreak, where we can't really get to the bottom of it right away, that may urge some caution or pause in a specific part of the province. And we already did that for Lloydminster, but then that was removed once it became clear that it was under control. It wasn't impacting broadly the jurisdiction. But the third point is that if for some reason we were to see a slow increase in community transmission that we couldn't pinpoint, that would be a caution for all of us first of all, just to reconsider what we're doing. What are we doing differently? Are we not paying attention to hand washing or keeping a physical distance? It may even make us consider, should we promote mask use? There's been a lot of discussion about mask use. At this point, we don't feel we need to use masks while out and about because we can safely maintain our physical distance. But if we start seeing an increase in community transmission, we will have to look closely, which was diffuse. It wasn't localized to a sector or a geographic area, then we will have to have some hard conversations based on what we get through case content investigation, about why it's happening, what should all of us learn from that, and what should all of us do, because it could mean that, somehow through subtle increase in our social mixing, we are allowing COVID-19 to come up, and then hopefully we can tamp it down again, just like we have shown we can as a province in March and April. And of course, if that doesn't succeed, then we'll have to think of what do we do at that point.
We'll take our last question from the room. Staff?
Yeah, to the Premier, what do you imagine the federal government's role should be when it comes to contact tracing and testing?
Well, their role, first and foremost, would be in supporting the provinces and the territories in the contact tracing efforts, the testing efforts that we have, and they've been amenable to having that conversation and doing just so. So we are working, and I expect that will be a large topic of the conversation that we will have here this afternoon, as it was one that was a large part of the conversation that we had last week as premiers and the Prime Minister. The other area where the federal government has a role to play in contact tracing is with international travel. As with their border services agency, and that is a role that the provinces and territories actually need the federal government to work with them and to work collaboratively on ensuring that as we begin to contact trace people that are not just within the confines of our borders, provincial borders, but also our international borders, that the federal government is working so that we can communicate as to where those people have been, who they've been in contact with, if they should be deemed to be positive at some point in time. So it needs to be a collaborative effort on both testing and accessing testing materials, reagents, human resources potentially, but also on contact tracing, and in particular when it comes to international travel.
Follow-up, Steph?
Yeah, I mean, the closure of the U.S. border has been extended for at least another month. I guess it could be extended again. Do you think that the federal government needs to have some kind of a regime in place when it comes to contact tracing from Canada Border Services before it kind of is okay with lifting restrictions on that border?
I think that's some of the work that's happening now between the provincial premiers and the Prime Minister as to what does that structure look like. And in a way, we have a little bit of time to put this together collaboratively, working on what is this exactly going to look like as I said earlier, we reopen our economies. We're going to have that interprovincial travel start to increase first. And so how do we communicate between provinces? And then how do we work with the federal government so that we have that multi-level of government communication, not only between provinces and when it comes to contact tracing, but with the federal government on people that may be traveling internationally. I don't know whether the international travel ban will be extended. I believe it's out to June 21st, if I'm not mistaken now. I don't know if it will be extended beyond that. But as we reopen our Canadian economy, our U.S. economy, our North American economy, there is going to be a day when international travel is going to start to increase. That day is not today, and it's not even between now and June 21st. But it will start to increase in the months ahead if we are able to have the collective success among provinces and territories that we most certainly collectively hope we will be able to achieve. So these are conversations that are happening right now. We don't have that process in place today, but I think it's important, and it's important for Canadians to know, both in Saskatchewan and across Canada, that all levels of government are working on this, working very closely on this.
That concludes our time for today. For those that are on the line, we are not planning immediate availability for tomorrow or over the weekend, but we'll be providing case update news releases as usual and further updates as necessary. Thanks for joining us today.